Hey everybody, Jody Whitrow here with the Kiso Physical Therapy for our Therapeutic Thursday session, where we talk about different topics for injury prevention. Today, I wanted to talk about something a little bit different. Usually, I know I'm talking about movements or exercises to reduce injury, but today I wanted to talk about a broader topic called sleep hygiene. So, and this kind of goes hand in hand with some of the wellness discussions that we've had in the group. So I thought this could just give some tangible things that we can work on to improve our sleep. But first, I wanted to talk about how sleep is related to injury prevention. So there's been a lot of studies on the effects of sleep deprivation on people, and when you are chronically sleep deprived, that can have huge implications on just how your body functions. So some of the things that it can lead to is increased weight gain, cognitive decline, or having that fogginess in our brain, just not being able to think straight. It can also contribute to chronic diseases like coronary artery disease and diabetes. But if you think about it, at night when we're sleeping, that is the time for our body to be recharging and recovering. So if we're not getting good quality sleep, then we're really not allowing our bodies the full recovery that it needs. And that's what can contribute to injury over time. So not only is our body just not going to be functioning, at its best, but literally it's not going to be recovering as well from, the activities that we're putting it through. And that can really increase our risk of injury over time. So it's all well and good to say that we need to be sleeping better, but how do we do that? So I wanted to give you some tangible things to think about in regards to your sleep habits and see if any of these are applicable to you. So one of the big things is to set an alarm for turning off the TV. And setting an alarm for 1 a.m. is not an option. So if any of you have trouble sleeping and you turn the TV on and you just leave it on until you fall asleep, that can actually be stimulating your brain and contributing to some of the difficulty you're having falling asleep. So it's generally recommended, not to have the TV on or be around electronics, for about 2 hours before we go to bed. And that may sound like a lot. So if any of you are kind of guilty of this, I know this one right here sometimes it's on my phone pretty late at night checking emails or social media. And so anyway, Rome wasn't built in a day. So take baby steps in regards to weaning yourself from that. But I think you'll find that can really make a big difference. So decreased electronics, setting a timer for your TV. Also, we talk about the importance of hydration a lot, and it is super important, but I also have a lot of people complain, that they're having to get up in the middle of the night to use the bathroom. So if that's something that really affects you, where you're having to get up, multiple times in the night to use the bathroom, then you may want to think about restricting your water intake in the afternoon. I'm not saying don't drink any water in the afternoon. I'm just saying try to get the bulk of your water in, earlier in the day and early afternoon, and then really cut back and just have a little bit later in the afternoon. Some other things that can be helpful is an hour before you sleep, practice some mindfulness, some stretching, maybe do some yoga or breathing techniques. All of those things help to calm our nervous system down and prepare us for sleep. So that can be really, really helpful. The other thing is habits when we get into bed. And this is another thing that I think I've probably been guilty from time to time, is you lay in bed, and if you're not sleeping right away, you get up and go do something. Sleep can be a pattern that is trained. So if we lay in bed and then, 2 minutes later, we're not asleep, we're getting up and we're moving around, then we're actually training our body to be getting up and moving as soon as we get in the bed. So give yourself some time when you lay in the bed, at least, 30 to 60 minutes, and work on some of those mindfulness techniques if you need to, if you're having a hard time falling asleep. But try not to get up and do anything active once you get into bed. And over time, your brain will learn that, hey, when I get into bed, it's time to sleep. So hope that's helpful for some of you. I would love to hear, comments if any of you are struggling with sleep, what that looks like for you. What are some of your sleep hygiene habits? Where could you improve? I'm also going to put in the comments some of the other things that you can consider if the items that we talked about today aren't on your list. Hope you're all having a great day, and I'll talk to you soon.